The nervous system is known for its complex network of cells and nerves which carry the messages to and from the brain and spinal cord throughout the body. The nervous system is divided and categorized by the type of tissue supplied by nerve cells or by the location. The nervous system is divided into the central nervous system and the peripheral nervous system. The brain and the spinal cord are the two major parts of the central nervous system. As for the peripheral nervous system, it consists of nerves outside the brain and the spinal cord. Parts of the brain include the cerebellum, the cerebrum, the ventricles, the meninges, and the brainstem, which consists of the pons and the medulla. The skull forms a protective cavity for the brain. As for the spinal cord, it consists of gray and white matter, the spinal nerves, the dorsal root, and the posterior medial fissure. Infections of the central nervous system can become very serious. Parts of the CNS, including the brain parenchyma, meningeal linings, and the bones of the skull, are prone to be infected by bacteria, fungus, viruses, and protozoal organisms. Infections of the central nervous system include the following: encephalitis, meningitis, subdural empyema, epidural empyema, brain abscess, and osteomyelitis. Encephalitis is known as the inflammation of the brain. This causes brain swelling, which can lead to mental confusion, seizures, or any other changes in neurological function. Encephalitis usually occurs after a viral illness, such as a gastrointestinal illness or an upper respiratory infection. People might experience headaches, flu-like symptoms, neck stiffness, sleepiness, confusion, nausea and vomiting, seizures, and more. In more severe cases, people would experience weakness or paralysis, double vision, hearing and or speech impairment, or coma. Since encephalitis resembles other medical conditions, one must seek medical attention immediately. A CT or an MRI would be the best modalities of choice to demonstrate encephalitis. The earliest and predominant findings in hepatic encephalitis are poorly marginated areas in the temporal lobes and the inferior frontal gray matter, which have high signal intensity on a T2 weighted MR image and demonstrate low density on CT scans. Meningitis is the inflammation of the meninges, or the thin tissue that surround the brain and the spinal cord. When bacteria enters the body and causes a cold-like infection, this is known as bacterial meningitis. This rare bacterial infection could lead to brain damage, stroke, hearing loss, and death. Imaging tests, including MRI and CT, will be utilized to diagnose meningitis. CT would be the modality of choice to rule out contraindications to lumbar puncture. MRI, on the other hand, would be the modality of choice since it is sensitive for demonstrating enhancement of the pia mater, the arachnoid membrane, and the subarachnoid distension with the interhemispheric widening that is dependable with early detection of severe meningitis. A subdural empyema is an infection between the inner surface of the dura and the arachnoid. A subdural empyema is most commonly located within the cranium. As this condition progresses, it acts like an intensifying mass lesion with an associated increase in intracranial pressure and cerebral intraparenchymal penetration. The increased intracranial pressure can lead to the disruption of blood flow or cerebral spinal fluid flow, which leads to cerebral edema or hydrocephalus. Common symptoms of subdural empyema include fever, lethargy, vomiting, headache, seizures, and neurological defects. MRI is the modality of choice for evaluating subdural empyema, unlike CT. MRI would be free of bony artifacts adjacent to the skull. Also, MRI will show the difference between benign effusions and infected empyemas. Epidural empyemas are rare, unlike subdural empyemas. This infectious process is located beneath the inner table of the skull and outside the dural membrane. Most cases of epidermal empyemas are a result of complication of sinusitis.
Epidural empyema can be asymptomatic. It can be accompanied by cellulitis or Pott's puff tumor and by osteomyelitis. This condition is not as fatal but can lead to other serious conditions such as subdural empyema, meningitis, or sinus thrombosis. CT would be the best modality to demonstrate an epidural empyema. A non-contrast CT would show the infection as a poorly defined area of low density next to the inner table of the skull. Treatments of subdural and epidural empyemas are relatively similar. Both conditions should be treated as a medical emergency. A craniotomy would be necessary to drain an empyema and any underlying sinus empyema. This would avoid a reoccurrence of an empyema. The patient will be given an antibiotic that would be used for a brain abscess. A brain abscess is a rare infection in the brain that is enclosed within its own area and localized to one or more parts inside of the brain. This may lead to complications with brain and spinal cord function. Viruses and bacteria are the most common causes of a brain abscess. The most common way for the brain to become infected is if an infection is spread from another area within the body. Infections can also be spread through the bloodstream from the chest area. Brain abscesses are more common in pediatric patients. In babies and younger children, the most common symptoms include a bulging fontanelle, seizures, projectile vomiting, fever, irritability, and lethargy. In school-aged children, the most common symptoms include nausea, vomiting, severe headache, changes in personality, seizures, and changes in speech. Symptoms of a brain abscess could resemble other medical problems, so it's important to seek medical attention immediately. An area of abnormal density with poor defined borders is the earliest sign of a brain abscess on an MRI or a CT scan. MRI is considered superior for demonstrating a brain abscess, although CT can be employed when MRI is unavailable. Treatment for a brain abscess would depend on different factors, including the extent of the overall condition, the age, overall health, medical history, and the patient's tolerance to specific procedures and treatments. The patient is given medication to regulate the infection, seizures, fever, or other conditions that might be present. The key treatment is to reduce the pressure in the head and drain the infection. Osteomyelitis is an infection of the bone and bone marrow that can be acute or chronic. This is caused by an infection spreading from one part of the body that is transported through the bloodstream to a bone in a distant location. When osteomyelitis occurs in the brain, it is usually caused by direct extension of a supportive process from the parastinal sinuses, mastoid air cells, or scalp. Common symptoms of osteomyelitis include pain around the ear or eye, hearing loss, and a draining ear. Vertigo can also occur as a result from hearing loss. Osteomyelitis of the skull can lead to facial paralysis if left untreated. This is caused by the compression of and inflammation around the facial nerve. Because of the complex craniofacial skeletal anatomy and associated aesthetic concerns, osteomyelitis of the craniofacial skeleton must be uniquely managed and is more difficult to treat than osteomyelitis of other bones of the body. CT would be considered the best imaging modality to establish bony erosions or destruction in osteomyelitis. It demonstrates any pathological changes, including erosions and lytic destruction.